Welcome to this Q&A from the Fertility Alliance. I'm Eilis Mathur, and today we're going to be discussing egg freezing. We're joined by Guy Morris, who is a consultant in reproductive medicine from Bristol. Thanks for joining me, Guy.
Hi,
Um,
thanks very much for having me.
to start with a brief overview, can you tell us what does egg freezing involve?
Yeah, so in terms of the the sort of nuts and bolts of the process, I suppose you mean. So in terms of actually, it's very difficult for a lady to just hand over her eggs for storage. So has to be, unfortunately, a process that involves ultimately retrieving those eggs from the ovary, so they can then be stored. So I mean, in terms of how that happens, in in the ovary normally, each month what you have is you have these follicles that sort of bubble away a little bit, and then a little wave of them starts to grow, and then what happens is one of them will normally become the winner and the other follicles just die away to the side, and then that winner sort of grows and grows and grows, and then when it gets big enough, the brain will give it a signal to release the egg. Now, actually, in this process, what we want to do is try and get as many eggs as possible. So the lady will take some medications on a regular basis to try and stimulate those follicles. So it takes a regular course of injections. So actually, of that wave of of follicles that have been sort of recruited, they sort of as many as possible will grow and grow and grow. Now, what you don't want is having done all that hard work to grow, lots and lots of follicles, egg sacs, as you might want to call them. You don't want to then ovulate all of them and lose them into your tummy. So before that happens, you need to take a final injection. And what that does is it just matures the egg within its egg sac so that it's sort of ready to be used, ready to be fertilized if and when it needs to be. And then you have to have a small surgical procedure whereby a often so the egg collection, so it's a scan inside the vagina. A needle goes through the vaginal wall into each one of the follicles and collects as many of the eggs as possible. Then the magic gets done in the lab. So that's when the embryologists take over, and they sort of look after those eggs. Often, when the eggs come out, they'll have a few extra cells around them that need to be stripped away so that they can ascertain which are the mature eggs that will then be able to be fertilized down the line if they wanted to be. And then they can freeze them. And it's sort of like a flash freezing process, something called vitrification. And then these eggs are essentially frozen and can then be stored. Well, maybe go on to the sort of the rules around that later, but actually can be stored for as long as you need them to be for the future, so that if you want to come back and use them, they're there for you.
Okay, interesting. And then how many eggs would you need to get frozen to have a good chance of success?
Yeah, I mean it's a surprisingly, it's a bit of a piece of string question at times, and it's one that's certainly been asked. As you may well know, ladies are born with all the eggs they're going to have at the start of their life, and sadly, over time, that number declines. But sadly, not only do the number of eggs decline, but actually the quality of those eggs decline. So, as you get later on in your reproductive life, to give yourself a good chance, you're going to want to have more eggs. Now, depending on how one defines a good chance, is going to be where you set a threshold. And there have been a couple of interesting studies that have looked at that. And one of the sort of I guess the more famous one has looked and said, so for a 90% chance of achieving one live birth when you're around 35, you need about 20 eggs. Okay. And then if that goes up, then so to achieve a similar chance, you then need, at 37, you maybe need to freeze as many as sort of 25 to 30 eggs, and then above 30 as you go beyond those years. So it really is the more eggs you can freeze, the better chance you have. And some people would want more than one child, and so again, you would need to increase your number of eggs accordingly from that point of view. So yeah, it's a bit of it depends on your egg reserve, it depends on your age, but broadly it's going to be sort of 20 or above.
Okay, interesting. And then on that, is there a best age to freeze your eggs at, or is there like a limit to how young or old you should be?
Yeah, again, I think there's different ways of looking at that question, aren't there? Which is, there's the pure science of it, which is, as we said, when you're egg reserve is slightly higher, you tend to be slightly earlier in your reproductive life, and the quality is slightly higher as well. So under the age of 35 is going to give you the best chance in terms of numbers of eggs to freeze and the quality of those eggs. But a lot of people aren't in that place in their life when that's available, and so when they come to it, and so you have to just help people with when they come to that point, and give them the information to make the right decision for them, really.
Okay, interesting. And I guess you sort of covered it, but say you then decide to freeze your eggs, what is the next sort of process? How does that go? The next steps?
Depending on where you are, it will be jumping on Dr. Google and finding a local clinic that offers that as an option to you, and where, depending on where you are, either in the country or in the world, and there'll be different ways of identifying a clinic local to you. If you happen to be based in the UK, there's a regulatory body which is called the HFEA, so you can check out the clinics that are local to you, and it's just really important that you find a place that you feel like you trust, that works for you, because it's a very intimate process, and it's really important that you're happy going there, but also that you check them out as well.
Okay, definitely. That sounds interesting. Are there any risks with the process and with egg retrieval especially?
Yeah, so I suppose taking it in order, really. So when you're going through that stimulation process, you've got the risk that you might over respond to the stimulation. So if you are, if you have a very high egg reserve, then there is the risk that you can have this over response where you get loads and loads of follicles, and then there is a small risk of something called ovarian hyperstimulation. Now, thankfully, we're very good at recognizing those at risk at it, and we're very good at planning their treatment cycle to minimize that risk really, really well. But unfortunately, it does still exist. Conversely, there's also the risk of under responding. So whilst we have tests that are good at predicting how someone might respond to the stimulation, it's not perfect. And so we might think, oh, we're gonna anticipate this kind of response, but you might respond less, and therefore you might get fewer eggs than you were anticipating, and sadly some people might get no eggs to no response. Again, it's rare, but that those are the risks. And then you're right, which is the next step. As you go through to the egg collection, that is a surgical procedure, and therefore it carries the risks of an operation. So you're passing a needle through the vagina into the ovaries. So there's the risk of bleeding. So that can either be from the vagina itself or from the ovary. Now, that risk is, it's relatively low. Hundreds of these egg collections get done each year within clinics all over the city and all around the country. Well, tens of thousands of cycles get done. But if you are unfortunate to suffer, a significant bleed, certainly from the ovary, that can be a bleeding internally, you might need admission to hospital, and very rarely you might need keyhole surgery inside the tummy or a blood transfusion to help you. There is the risk of an infection in your tummy, and that's increased if there is a bit of bleeding at the time of the egg collection. And again, it's rare. So, but if you get an infection in your tummy, it may be that you would never have had a problem with sort of fertility or achieving a pregnancy down the line. But then as a result of an infection in your pelvis, that can cause damage to the tubes, and then can then lead to future fertility problems. So again, that is rare, but clearly if it happens to a young, healthy person, that's a real, that's a real significant complication. The risk of damaging structures that are in your tummy, so near to the ovaries. So there's a lot of important clockwork down there. So you've got the bladder, which sits nearby. The bowel obviously sits in that area, and there's blood vessels, and there's tubes that drain your kidneys to your bladder called the ureters. Now, thankfully, the egg collection is done under ultrasound guidance, so the person that is operating it will be able to see exactly where the needle is going through at all times. So actually the risk of those damage to that is incredibly low, much less than 1%. But again, if it happens to you, that's really significant. And then if we think after that, then just sort of going chronologically, if you like, then there's the risk in the sort of the lab side of things. Now, the process of how the embryologists look after the eggs and freeze them has improved so much over the last few years. It's an incredible technology. And so now, in terms of, your expectation for the eggs to be able to survive the freezing and thawing process is so much higher. You're talking over 90% is the expectation, really. But of course, that's looking at a big cohort of people. So there is a risk that you might be unlucky and fewer of your eggs might survive the process. So there is a risk that your eggs would not survive that freeze thaw process. But as I said, the technology's got so good now that it's very reasonable that you should expect most of them to.
Okay, good to know. And can you go through the egg retrieval process, the egg freezing process more than once?
Yeah, absolutely. Um, and there was an interesting study that came out, I think, just earlier this year, and what it showed, as we were talking about how many eggs do you want to get,
Mhm.
um, how many people going through this actually get their desired number on one stimulation. It's under 5%. So actually, I think the expectation almost might be that you would need to do it more than once in order to try and build up and bank those eggs for yourself to give yourself that sort of meaningful backup or insurance plan if that's what you're choosing for.
And can you get egg freezing through the NHS? Is it available on the NHS?
So yes and no, sadly. In terms of if you are due to have a treatment that would significantly affect your egg reserve or significantly impact on your future fertility, then egg freezing as a form of sort of fertility preservation is supported by the NHS. And that will be very specific to different localities, so different areas. The funding bodies will have slightly different rules around that, but those processes should be in place. But for people that want to freeze their eggs as a sort of insurance or a preservation against sort of the natural aging process, because they're not sure whether they've met the person or what their family planning is, unfortunately, so that gets sometimes termed social egg freezing. That's just to separate it out from that sort of slightly more medical process. But that's not supported by the NHS, so that would need to be done on a self-fund basis.
Okay, and how much might that cost if you are paying for it, self-funding it?
Yeah, so it's, I think, as we were talking about when identifying a sort of a clinic that you feel comfortable with and that they should be really, hopefully, really clear about what the costs will be, and that will vary from area to area, clinic to clinic. So it's really important that you feel happy that they've, I guess, given you a really clear idea of what the cost is going to be. If we look at the HFEA website, which is a really good resource for information, they cite that a round of egg freezing costs about £3,000. With the cost of drugs on top of that, and that can vary between £500 to £1,500, just to give a sort of a ballpark idea of what it might cost.
Okay, interesting. And is egg freezing an option for trans men?
Yes, certainly is. Yes, and I think that is um, something that is becoming more, I think, more common. As in, we're becoming more confident and doing slightly more cycles of the for trans men. And again, that's certainly something that you should reach out to the local fertility clinic to inquire about what is available from that point of view.
Okay. And then sort of once you've had your eggs frozen successfully, how does it look like with storage? How long can you store your eggs for? What are the next steps then?
Yeah, so in terms of the purely pragmatically, that they can be stored for as long as you need them. From a sort of rules point of view, so again, the sort of legislation says that they can be frozen for up to 55 years, but that the consent must be so you give consent to store your eggs, and that consent must be renewed every 10 years. So whilst the total, the longest it can be is 55, you must renew your consent every 10 years. So if you fly to the moon and set up camp there and never communicate with your fertility clinic and do not renew your consent, then unfortunately your eggs would be taken out of storage. The other thing that is limiting is that unfortunately there may well be a cost implication. So again, this is something that's really important to talk to the clinic about. So the upfront cost may cover some period of storage, but there may be an ongoing payment from that point of view. So those are the sorts of things that may impact on your decision about how long to store it.
Okay, interesting. I guess finally, is there anything else you think people who are curious about egg freezing should know about that isn't maybe widely discussed already?
Uh, no, I think it's just really great to be talking about it, because I think one of the things that we do see when you were talking about what is the best age, and I'm very careful about not necessarily that in a sort of making a value judgment about that necessarily, but I often see that we tend to see people later on in their reproductive life when they come to talk about it, and um, actually just being able to get information out there and raise awareness so that people are able to make the decisions that rights for them, whatever decision that is, in a timely manner, hopefully gives people the best possible chance to when they think about their future sort of family planning options. So I just think it's really great that we're sort of talking about this and hopefully getting that awareness out there a bit earlier.
Great. Well, thank you so much for joining me. This was a very insightful conversation. Thank you.